Welcome to a very special presentation by Dublin City Schools. I'm Jason Holcomb, joined today with Dr. Thomas Kraft from the South Central Health District. They've been kind enough to join us today to give our teachers some much needed advice and tips to hopefully calm some fears and encourage some best practices. Dr. Kraft, as somebody who's raised a bunch of children and put them through school, I know that there's a lot of challenges in everyday life just to get them ready for school, and this year is going to be very unique. What are some things that you're trying to encourage when you come across parents, whether it's through your church or through the community at large, hey, this is what we need to be doing to make sure that our kids and our families are safe?
Well, I think one of the things that could be done as part of the process of getting ready for school every day is go ahead and begin to develop a regimen about checking temperatures at home and asking your kids about symptoms at home before you prepare to take them to school. The best thing that you could do at this point is not to send sick children to school, and if you wait and have them screened at school without some home screening first, then that increases the risk of spread. So I would encourage families to go ahead and try to develop that pattern in the morning of just asking how the kids are doing and maybe doing some temperature screening at home and making decisions at home about not sending sick kids to school.
And I love that you said that, simply because, we're not doctor's offices at the school, obviously. We have some of the finest nurses you're ever going to find, and I think you would vouch for that as well, Dr. Kraft. We have just phenomenal nurses at our school system. But when you talk about the potential volume, you can't manage that volume with a handful of school nurses. One of the other issues that has come up regularly is testing. Obviously we've been having testing clinics set up at Southern Pines and a variety of other spaces. And I've had a lot of people at different points wanting to know, when should I get tested? Because there are a lot of people that worry from the asymptomatic standpoint. There are a lot of people that are worried, well, is it my allergies? At what point do you feel that people should make a conscious effort to go participate in the testing?
Well, there are two times that we consider testing. One is if you know you're exposed and then become symptomatic, you should consider testing. The first thing that we want people to realize is that when you're a close contact of a known positive, you automatically fall into quarantine. And testing early won't test you out of quarantine. So we encourage people to follow the quarantine rules that you should follow. Those will be reinforced by phone calls from public health. But we encourage people to quarantine at home, not get tested early unless they become symptomatic, and then at least wait till day 10 to test during their quarantine period. Other people that should consider getting tested even if you don't have known exposure. If you develop classic symptoms, we would encourage quick testing. If you develop those iffy symptoms or those symptoms that you feel like you may have from year to year and you don't have known exposure, I would consider seeing your primary care physician or an urgent care after notifying them first that you're coming if you have fever. Some of them have alternate entrances or different procedures to go through to try to keep COVID out of their offices. But just like in years past, every sniffle's not going to be COVID and every fever's not going to be COVID. But it's certainly, we have a heightened awareness of that. So if there are typical minor symptoms without known exposure that persist for 24 to 48 hours, you might consider a medical evaluation first unless you've had known exposure.
Now, one of the other things that has come up regularly as the case numbers both in the state and in our community have gone on the rise is, what can we do individually and collectively to mitigate this? Because obviously early on we sheltered in place, and that was practical in some regard, but then it was impractical in other regards. Sure. So what are the things that we can do now in this new normal to practice safety? And I know, you see me right now wearing my mask, obviously.
And I would be too if we weren't more than 6 foot apart.
Right, which is a good emphasis why we're doing this today, is to emphasize how we should be engaging. But tell us for a minute, what are those things that we should be actively doing every time that we're engaging in the public?
Well, the public health message has been the same for a while, and we've tried to figure out ways to quickly make that available and accessible and rememberable. So we use the motto of the 3 W's. The 3 W's are to wear a mask in all public spaces where you can't guarantee social distancing. The second W is to watch your distance and socially distance at least 6 foot apart at all times as much as you can. And the third one is to wash your hands. Hand washing is recommended with soap and water for at least 20 seconds. When you wash your hands, do that as frequently as possible. And when you can't do that, use hand sanitizer that's 60% alcohol or more as a substitute. But we encouraged frequent hand washing and always wearing a mask. And then, of course, outside of those things, in public settings, we still encourage that. You know, we're talking mainly about school setting today, but out in the public settings, those things need to be followed as well. Follow those same guidelines when you go to the grocery store. Follow those same guidelines when you shop. Follow those same guidelines if you choose to attend social gatherings. Try to keep those social gatherings as small as you possibly can, because the more we expose ourselves in public settings, the more we risk bringing COVID-19 into smaller private settings, particularly our workplaces and our schools.
Well, and again, this is such a new thing for all of us, and the one point that I try to emphasize that I've actually been doing since February and March when this started escalating was the level of empathy and grace that we have to extend to everyone, because this is new territory for all of us. You know, we have not been involved in anything like this since 1918. That'd be a grandma or a great-grandma or a great-grandpa. You know, that's a long time removed. So this is all new, and I think one of the things that I've seen emphasized by the scientific community was the idea with these tests. You know, these tests didn't exist a year ago. And so the possibility of false positives and false negatives, because I've heard some people concerned about that, but the reality is, and I don't want to speak for you, but it seems to me like this is just part of that scientific method of trying to, you know, refine these processes. And so what would you tell people, you know, if they get a test, how would you determine if one was a false negative or a false positive?
Well, the first thing I try to encourage as a physician is, you know, there's a lot of hearsay out there and there's a lot of misinformation out there. As a physician, I try to encourage people to follow the science. The second thing that I try to remind people is that it's developing science. Just like you said, we've not had anything like this in our lifetime. Very few people still live that were alive during the 1918 flu pandemic. So, you know, tests are new, procedures are new, and our guidance is new. And people get frustrated by the fact that it's changed with time, but it's changed because we've learned, and it's gotten better because we've learned. And people need to realize that that what you're hearing is changing guidance is actually better guidance over time. From a testing standpoint, there's mainly 3 types of tests that are available now. I still like to remind people that PCR testing, or the deep nasopharyngeal swab that you do, is still the gold standard for testing, and it has an extremely sensitive positivity rate. It's the best for determining if you have COVID-19 or not. The next best test is antigen testing, which is a quicker test. It's still a nasal swab, but it's a quicker testing type that's similar to pregnancy tests or strep tests, but it still detects the presence of the antigen of the virus, or the viral capsule of the virus itself. And so it's detecting virus, and it's 80 to 85% positive if you have symptoms. The antigen test is not meant to test as a screening test. It's meant to test if you're having symptoms and known exposure in the presence of widespread disease. So I tell people, just like you wouldn't go to the doctor and say, I just want to know if I have strep throat today, I want a strep test. You shouldn't do that with the antigen test for COVID-19. You should go and request that test if you have symptoms and suspected exposure. And then the last test is antibody testing, which is the least sensitive of all. Antibody testing detects the antibodies that you develop after exposure to the virus. COVID-19 is a coronavirus, and the antibodies that we develop to COVID-19 can be similar to antibodies that we developed to other coronaviruses that just cause common cold. And so there's cross-reactivity between those two types of coronavirus. And so really, when you're trying to detect current disease or active disease, the antibody testing doesn't really have a place in determining that. It will become progressively useful down the road as we progress through the pandemic, but it doesn't help determine active disease.
Well, Dr. Kraft, I want to thank you so much, and Melissa Brantley, who'll be joining us shortly, for taking this time out of your day to talk to our teachers specifically and to help provide some resources that they can use. It's been an honor and a pleasure to get to partner with you. You know, for those of you who've been watching, if you see behind us, these are some of the partner projects we've been working on, all designed to help promote and encourage safety and hopefully help eradicate this disease. So thank you, Dr. Kraft, so much for joining us today.
Well, thank you, Jason, for having us, and we truly appreciate the partnership that you've had with the Department of Public Health in getting out the message and helping us fight COVID-19 and slow the spread.
You've probably heard a lot lately about contact tracing. Along with widespread testing and social distancing, it's an important public health tool to try to stop infectious disease outbreaks like COVID-19. So what is contact tracing exactly, and how can you help? The idea of contact tracing is fairly simple: to quickly identify people who have had close contact with someone with COVID-19 while they were infectious. Then for those contacts to quarantine themselves, stopping the chain of transmission to others. If we can trace people who might be infected, then they can get tested, stay home, and monitor their symptoms. If you test positive for COVID-19, the Georgia Department of Public Health will call you. We'll ask you where you've been and who you've had contact with, but there is no electronic tracking. Then, DPH will call those identified contacts to let them know they may have been exposed. We'll explain how to get tested, quarantine yourself, and monitor your symptoms. Remember, to stop the virus, spread the word. All you have to do is answer the call. To learn more, go to dph.georgia.gov or call us at 1-844-442-2681.
Welcome back. I want to thank everybody from the South Central Health District for joining us today. We're talking about COVID-19 prevention. I want to talk about best practices as well. I'm joined right now by Melissa Brantley with the South Central Health District. Thank you so much for joining us, and want to talk for a second to teachers and to students and to parents about some of the things they can do to help prevent the spread of COVID-19 and protect their families. And the first question that we had was, what can teachers do to promote a safe environment in the classroom?
Well, teachers can follow the 3 W's. It's a message public health has been trying to get across to our community for a while now. The first W is to make sure you wait 6 feet from other people, to socially distance when you can. And so encourage your students to have that 6-foot boundary between them and other children and other people when they're in the classroom and when they're out of the classroom as well. Also, to make sure you're wearing some kind of cloth face covering. We encourage that when you can't social distance. And then also make sure you're washing your hands. So wash your hands regularly. Encourage students to wash their hands regularly throughout the day. When they can't wash their hands with soap and water, use an alcohol-based hand sanitizer.
Well, I love the 3 W's. Mm-hmm. That to me makes it common sense. Wait, wear, wash, and talk about when teachers are in and out and about in the community. That's another thing, because we talk regularly about we can do a lot of things to protect people when they're in school, but we can't do anything for them when they're out of school. What are some things that teachers can do to ensure that they're coming back into school every day safe and healthy?
That's a great question, Jason. I think that we as a community, whether we're teachers or really anyone in the community, need to follow the 3 W's, but we also need to make sure we're doing our part to social distance in the community so that we're not exposing ourselves to COVID and then bringing it back into the classroom. So the best way we can do that is to make sure we're limiting group settings make sure we're limiting our exposure to big group gatherings and things of that nature. And that when we're out and about, we're still practicing those 3 W's.
Yeah, I really think that, people think that our family is a bunch of nomads because we pretty much keep to ourselves, and
We've done the same thing at my house. Yeah.
It's just what you have to do. And one of the things that we're trying to do regularly is try to teach our kids that, hey, there's other ways we have to do things right now. This is not permanent, but this is just what we have to do right now. And speaking of children, what can parents do to get their kids prepared for the return to school? Because, not everybody's going to be in a position to have their children online. We're going to have a lot of children coming back to campus. What are some practices that parents can now do that's going to get them ready for their children to come back to school safely?
Well, I think preparing them with that message, the 3W message, teach them how to keep that space and that distance between them and other people. So when you're taking them out into a store right now, hopefully they're wearing their face covering, but tell them, we're standing 6 feet apart. We don't want to get in their space. They're not in our space. Also, I think it's important now, and I've started this with my kids, is letting them wear the face covering at home. Get used to that so that when they're in the school environment, this isn't a new experience for them. I even said you can make it a game at home. Who can keep their face mask on the longest? So that this was becoming something normal for them, that it's not a strange experience. I would hope we wouldn't all throw face masks on our kids on the first day of school. We can't expect them to wear them for a long period of time if they're not used to it. In our office, it's something we got used to, and now I think it's become kind of a habit. We're used to wearing them at work. And you can train kids the same way. Just start early, getting them prepared for wearing these.
Well, my kids are getting more familiar with me. Obviously, they're not going out and about to need a mask. They're staying at home mostly. But they're used to seeing Dad come home sometimes and he's wearing his mask. And they're used to me having to leave with a mask. In fact, yesterday we made an hour-long trip to Aldi. One of my children has a gluten sensitivity, and they have some of the best gluten-free options. We did the pickup. So we took a road trip to go sit in a parking lot, and for an attendant wearing a mask 6 feet away from me to say, are you Megan Holcomb? And I said, no, but I'm her husband, and you can put the stuff in the back. And then we drove immediately back home. So, we've kind of had to rethink road trips, and, we try to pick outside spots. At one point, we actually went to the Museum of Aviation, just stayed outside. We walked around the outside exhibits. We actually picnic lunched under the B-52, and then we came home. We made sure that we were nowhere near anyone the entire time, and it was a good time. But, it's just trying to rethink some of the things that people can do. Finally, Ms. Brantley, what are some common practices that all of us, and I know we're going to probably hit on this same thing that we've been talking about with the 3 W's, but I imagine it can't hurt to keep bringing this back up.
Right. I feel like a broken record, but it really is those 3 W's. When we talk about waiting 6 feet apart, that's important when you're in confined spaces, when you're in a grocery store, when you're in the pharmacy getting prescriptions or something like that. But we also mean waiting 6 feet apart, social distancing. And it's so important. I think what you said is important to remember. This isn't a forever thing. It's a short-term thing. And if we can think about following that guidance for a short time and get through this, then we can hopefully return to our normal activities. But for now, the best way we know to prevent and stop the spread is to avoid those big social gatherings where we can ultimately spread it to a lot of people. And where we can get exposed to the virus. So we want people to limit those social gatherings whenever possible. And if we're doing that, then hopefully we can see a decline in cases in our community. If we're doing that and we're following those 3 W's, we're still washing our hands, we're using hand sanitizer when we're out and about, wearing our cloth face covering, then we're doing all we can do to slow the spread. And so we just have to stick with that guidance for now.
You said that, and I want to say that my dad was a little prophetic back in the day. God bless him, he's gone home to be with the Lord, but during his existence, everybody used to tease about the way he washed his hands because they said it looked like he was going into surgery. And it's so funny now that for us as people, we're having to wash our hands exactly as my dad suggested all those many years ago. So thanks, Dad, for putting that in me, because now I've got a bunch of hand washers because I wash my hands religiously and thoroughly. We want to thank you, Ms. Brantley, for taking time out of your day to come speak to us about this very sensitive issue, and hopefully together we can help make a difference.
Hopefully so, and we appreciate you having us.